Gotta love technical difficulties. So I was saying that the two crazy ketos, I had the opportunity yesterday to drive up to the Redmond mines, and I really enjoyed talking with them. I had no idea they were going to be introducing everyone, so it was a kind of a nice bonus. So obviously I'm known for women and intermittent fasting, largely because of a talk I did 3 years ago. But prior to that, I did talk quite a bit about both genders and intermittent fasting. But before we talk about gender differences, one of the things that I think is so important, and let me back up a little bit, I worked for 16 years as a nurse practitioner in cardiology. I saw the net impact of metabolic inflexibility and poor metabolic health. And that is why I'm so passionate about talking to people and patients about metabolic flexibility. So we're going to take a little journey. We're going to do a little bit of statistics. I promise we will emphasize the gender differences. But there's a lot of information I think is equally as important. And so that's a lot of the focus today. Okay, I love quotes. The best of all medicines is resting and fasting. Obviously, Ben Franklin has been deceased for a long time, but fasting is not new or novel. Unfortunately, our culture would like us to believe that this is something that is new and fresh. And I remind people it dates back to biblical times. This has been part of us from an ancestral health perspective for thousands of years. Okay. What I like to speak about is this public health crisis that we're dealing with. It is important, not just for clinicians, but every one of us to focus in on the fact that 1 billion people worldwide are obese. According to the World Health Association organization, rates have tripled since 1976. 42% of Americans are obese, exacerbated by the pandemic. I was looking at these statistics when I was making these slides, and has increased by 26% since 2008. A survey by the American Psychological Association Pandemic averaged 30 pounds of weight gain, with a median of 16 pounds, and 10% of us gained more than 50 pounds, largely due to sleep disturbances and alcohol use. Let that kind of be absorbed. The last 2 years have really impacted us profoundly on every single level imaginable. When we talk specifically about the United States, we have this metabolic health status. 37.9% of men, 41.1% of women in the US are obese, twice as many as 3 decades ago. 20% of children are overweight, 3 times as many as 3 decades ago. When I was growing up 1,000 years ago, back in the 70s and 80s, you didn't see obese children. You really didn't. In 2020, 16 states in the United States had adult obesity rates greater than 35%. 173 million Americans are pre-diabetic, many of whom do not know. 130 million Americans are insulin resistant or diabetic. 25% of Americans have something I call NAFLD, non-alcoholic fatty liver disease. High blood sugar is linked to 8 out of the top 10 leading causes of death. And when you look at the statistics and you look at where people are most vulnerable, there are systemic and social inequities. I trained in inner city Baltimore. You better believe the statistics for inner city Baltimore are very different than they are for affluent parts of the United States. I don't want this to be all negative. I just want to provide some basis for why metabolic flexibility is something we should all strive for. So when we're looking for markers, so if you're sitting in the audience, you probably have heard of something called metabolic syndrome. Obviously in cardiology, that was my bread and butter. So we know that there are gender differences that impact metabolism, and we'll talk about those shortly. We know that there is a global prevalence of more men than women that have type 2 diabetes. When you're looking at markers, so when you go to your doctor, your nurse practitioner, your PA, and you're doing your annual exam, these are things that you need to be looking at and asking for. And hopefully if you're in this room, you probably already have a great relationship with a provider. So if you are metabolically unhealthy, if you have metabolic syndrome, your HDL, if you're a man, is less than 40. For a woman, it's less than 50. Your triglycerides are going to be greater than 150. This is important because more often than not in cardiology, I would be looking at lipid panels with patients and I would talk to them if their triglycerides were 300, 400, 500. Higher than that, we start worrying about pancreatitis. And I would ask them, what types of processed carbohydrates are you consuming? It's not a sweet potato that's going to give you high triglycerides. It's processed crap. I know Dr. Ken Berry is going to be speaking tomorrow, and I know he talks a lot about this, but it's sodas and pastries and cookies and cake and things like that that are going to really elevate those triglycerides. If your fasting glucose is greater than 100, or your fasting insulin, in my estimation, is greater than 6, you want to really be focused in on this. High blood pressure, defined right now as 130/85. And if your waist circumference as a man is greater than 45 inches or greater than 35 as a woman, this is a sign that you more than likely have got some degree of metabolic inflexibility. Okay, so how did this happen? This didn't just happen overnight. And as a clinician, over more than 20 years of practicing, I've seen a lot of changes that have impacted us on a profound level. So we talk about the rise of the processed food industry. It's a $100 trillion per year with $450 billion in profit. They are not looking out for anyone. No one. They are profit focused, they are not health focused. Our portions have gotten bigger. I call it portion distortion. Oftentimes when you leave the United States, maybe we haven't been able to do that as much over the last several years. You look at other countries, when a meal is served to you, it's half the size of what you get in restaurants. We're becoming more sedentary. 1 in 4 Americans sits greater than 8 hours a day. My greatest pain point, meal frequency, snacks and mini meals. We've been telling our patients for years, eat to stoke your metabolism. Breakfast is the most important meal of the day. You need to eat 3 meals a day and snacks in between to stabilize your blood sugar. Consumption of highly processed foods, including seed oils. Seed oils are vegetable oils, canola oil. You think about soybean oil, sugar and soy. And frankly, a lack of prioritization for nutrition research by the federal government has not helped things. And I'm going to talk about one strategy that can help all of this. Who in here already intermittent fasts? Awesome. Okay. So why fasting is invaluable for metabolic health. Now, many of you might be looking at the mitochondria graphic that's on here and saying, I have no idea what this is. Our mitochondria are the powerhouses of our cells. They get damaged over time. If you're north of 40 years old, you very likely have dysfunctional mitochondria. But fasting is one of many ways that we can improve the mitochondria. When we fast, we actually will use the ability, once we're metabolically flexible, we will be able to tap into fat stores for energy. We use the term fat oxidation, but the way, kind of layman's way of looking at it is it helps you burn fat. And there's a really cool way of looking at fat. Fat isn't just fat. Fat is this incredibly sophisticated inflammatory process. Now, most adipose or fat tissue is white fat, but we can actually transition fat from the white fat that's inflammatory and non-beneficial, we can actually make it brown fat, which is metabolically active. And we can do that while fasting. I know that Dr. Letsky already talked about the importance of the gut microbiome. Well, fasting is critically helpful and beneficial for gut health. So we talk about it helps with the gut microbiome balance, aligns with circadian biology. One thing that I didn't touch on is that we have circadian clocks, not just in our brain, but throughout our gut. This is why eating within 3 hours of bedtime is not particularly helpful, not only for sleep, but also for blood sugar, because we become more physiologically insulin resistant as the day goes on. So I always talk about how fasting can be very beneficial for aligning with chronobiology. We know that fasting helps with the small intestine. We have this amazing system called the migrating motor complex in our guts, that the only way that it is really working efficiently, it kind of works like a sweet sweeper. The best way that it works is when we are not eating with meal frequency. It actually needs 4 to 5 hours for it to work properly. We know also our gut microbiome is critically important for neurotransmitter. Our last speaker, we heard her talking about how she had crippling depression even as a child and young adult. And so the gut microbiome is critically involved with neurotransmitter production, serotonin, dopamine, etc. We know that when we help to enhance the mitochondrial function, it improves our energy. So many people, when they're new to intermittent fasting, will say, I came to intermittent fasting to change body composition. I came to lose weight, but I stayed because I felt so damn good. I know we're getting a little technical here. I'm not going to spend a lot of time on this slide because what I want to spend more time on is the gender differences. So there's a lot of technical terminology that goes along with intermittent fasting. We talk about the role of NAD, which is a form of gas that we can use for these proteins called sirtuins. We know that NAD actually declines with age, and it can be improved with fasting. It can lead to more energy and more anti-aging benefits. I think a lot of people choose to focus on the physicality of fasting, and what I like them to focus on is all the things that go on under the hood with the body. We know that autophagy, which is this really cool term, autophagy actually allows your body in a fasted state to go in and get rid of diseased and disordered cells. Cells that could potentially go on to grow into cancers or could make you more likely to develop neurocognitive disorders. Autophagy is only upregulated when we are not eating. So when you eat, it slows this and actually ramps up another type of mechanism called mTOR. We know that fasting, people talk about all the mental clarity they have when they fast. All of a sudden they feel like they can get so much work done, they have so much mental clarity, and it's because as our body is able to go in and break down these special types of fatty acids, we get diffusion of these ketones right across the blood-brain barrier. It's called why did I just have a brain fart? It's called beta-hydroxybutyrate. Too many B's in my brain. We know that fasting is beneficial for immunity. I know for a lot of people, we're not entirely out of this pandemic yet, but I remind people that fasting is actually incredibly supportive for immune function. You think about when animals are sick, they donate, they may drink, but they're not eating. And much like I encourage people when they're not feeling well, if you don't feel like eating, don't force yourself. Your body can do all the cellular work behind the scenes. We know that fasting also reduces inflammation and actually helps slow aging. Okay, by pure irony, Dr. Ben Bikman, who I think everyone in this room is probably very well aware of, I'm a huge fan of his, when we talk about insulin, when we're talking about fasting, we're going to talk about insulin. And so his quote is, a humble hormone from the pancreas. So Dr. Ben Bikman is an insulin researcher, very, very well-regarded expert in the metabolic health space. And so what I want you to remember, if you're not already fasting, or if you've been thinking about it, or if you've been a seasoned faster, to really understand that meal frequency can impact fat storage. If your insulin levels are up, then you're not able to tap into fat stores. If your insulin levels are down, then your body is able to intrinsically go in and use up fats. And as Ben Azadi always says, I would much rather use the fats in my body than be eating extra fats outside my body. In a 2018 study that was done pre-pandemic, obviously, UNC Chapel Hill School of Public Health, they talked about at that time 88.2% of Americans were metabolically inflexible and unhealthy. And this is particularly relevant because you just heard me talking about the pandemic and how those statistics have actually gotten worse, that we're just getting more and more metabolically inflexible. Another study with patients who fasted, they saw a 3 to 6% reduction in their blood sugar, and they saw a 20% decline in insulin events. This suggested that fasting is as effective as traditional caloric restriction at accelerating weight loss, protect heart health, and prevent type 2 diabetes. So there's so much more to fasting than just these benefits. Okay, we're getting closer to talking about the sex differences. How does fasting benefit hormones? Fasting glucose levels in plasma reflect the interplay between basal whole body glucose disposal and glucose regulation. What this is saying is you will become more insulin sensitive. When I'm first working with clients and we're talking about people who are dealing with insulin resistance or even diabetes, we start to talk about what strategies can you do to improve your metabolic health. And we think about even walking after meals, lowering your carbohydrate intake, increasing your protein intake, eating less frequently. There was a large cross-sectional study with 118 individuals that the prevalence of impaired fasting glucose was higher in men than women. I found that really interesting. There was a cohort of 8,000 Swedish men and women evaluated for insulin, and prevalence of impaired fasting glucose and diabetes was twofold higher in men compared to women. So now we're kind of weaving in these statistics about differences between men and women. And based on large cross-sectional trials, men might be more prone to insulin resistance than women. I again found this surprising. Higher glucose uptake in female skeletal muscle, which means more insulin sensitivity. We want to think about muscles as an organ of longevity. You want to maintain muscle mass as you get older, can also help with this insulin sensitivity. This is why when I'm working with women, I talk about the importance of doing strength training, not doing chronic cardio. Walking is great, and doing, if you want to do Orange Theory Fitness and that works for you, great. But one of the most important things you can do, and this is not specific to men, but for both genders, is to really make sure that you're maintaining lean muscle mass. Okay, I threw this slide in here really just to kind of be funny. Being a woman is a terribly difficult task since it consists principally of dealing with men. Now I want to be clear, my husband's in the audience, I have all boys. I just did this as more just to kind of break things up as we're kind of transitioning into the gender specifics. Okay. As it pertains to men and women, it isn't all equal, and we'll talk about this in a second. Okay, I found this really interesting when I was preparing for this talk, the realization that a lot of research dollars that are out there, up until a certain point, so in 1977 and 1993, women of reproductive age were required to be excluded from phase 1 clinical trials because of concerns about teratogenic, which means they were concerned about the potential impact on a fetus or a pregnancy. Now, what this means is that for a long period of time, women have been left out of research studies. So when people ask me, where's the research when you're talking about these topics, I always have to remind them that a lot of research that's done on fasting, as one example, is done on rodents, it's done on men, or it's done on obese menopausal women. And so as I remind people, we need to continue to do the work so that we can better represent all women. Research, there are potential complexities, and this is actually a quote, of controlling for a woman's menstrual cycle serves as a deterrent for the inclusion of females in experimental design for both animal and human studies. I found that really interesting. There was actually a researcher who went back and was trying to find out why there were inequities about specific types of research done on women, and they started to look, there was a gender bias because having to account for a menstrual cycle was an inconvenience to the researchers. I get it. You can't control it, right? Since then, there's been increasing emphasis on the inclusion of women in clinical trials, as well as statistical analysis that specifically evaluate possible sex differences. As I stated, most research is done on lab animals, and last time I checked, our reproductive cycles are not the same, men and then menopausal women. So when I start talking to people, and obviously I just recently wrote a book talking about the differences between, or how women have to fast very differently, I always remind people that a lot of the research that's been done, there's not enough. So that is going to be forthcoming, and there are obviously a lot of clinicians, Dr. Jason Fung and I have talked about this ourselves. There's a lot of good research that's ongoing that will improve for things. So when we talk about differences between men and women, the two that I like to focus on the most are related to bone and skeletal muscle. Obviously there are other changes. There's brain physiology changes. There's changes in our immune systems, our liver, and our vasculature. But skeletal muscle in particular is of tremendous interest. Okay, so we go through puberty. This is when you start to see some significant secondary sex characteristics between both genders. We know just based on this information that females gain more body fat versus males, and men tend to gain more lean muscle. I have 2 teenage boys. I can see, the amount of muscle mass they have on them far exceeds my nieces who are the same age. Females generally tend to gain fat tissue peripherally and on their hips, and men tend to gain it the most in their waists. It's interesting. I was reading recently that most women, it takes them up to 10 years for their reproductive cycles to regulate. So when we're looking at a young woman at 12 or 13 years of age starting their menstrual cycles, it may take up to 10 years for their cycles to become regular. And actually the research looks at their body fat has to be at about 17 to 22% for regular menstrual cycles. And for many young women, that may take quite a bit of time. Men, big gender differences, more muscle mass with higher output, higher capacity for anaerobic metabolism. They have more bone mass. It makes sense. Generally, men are heavier. They have lower body fat. And related to an impact of steroid hormones, specifically testosterone, not surprisingly, but also IGF-1. And I'll have you all know, my teenage boys looked through these slides to make sure they felt like they were both very gender balanced. Okay, for women, and there's a little bit more detail in here because we just have a little bit more complex physiology. So I talked about why skeletal muscle is so important to maintain, especially north of 40, because there's something called sarcopenia. This is not unique to women. This also happens to men. It's muscle loss with aging. As you lose lean muscle mass, you become less insulin sensitive. That is why it's so important that you're getting enough protein, that you are even doing body weight. You need to be doing strength training exercises throughout your lifetime, even more importantly as we get older. So we know that skeletal muscle is very important for insulin sensitivity. We know that there are differences in muscle mass that allow for greater flow. So it's interesting, men have more muscle mass, so they're going to maintain more insulin sensitivity than women. And women in many ways, even though our muscles are a little bit more attuned to being insulin sensitive, until women start heading into perimenopause, the 5 to 10 years preceding menopause, and menopause, they maintain a degree of insulin sensitivity. It's as we get closer to menopause, and we'll talk about that in a second. We know there's distinct gender comparisons in the skeletal muscle that I mentioned earlier. The highest body fat deposition in women impacts circulating inflammatory particles, which can impact metabolism and skeletal muscle for receptor thinning. Now, I think the big takeaway, because I can go through these slides and I can talk all about the research, is that until women go through menopause, they maintain a certain degree of insulin sensitivity. So muscle mass becomes increasingly important. Men get a little bit of a pass. They don't lose as much muscle mass as quickly as women do as they're heading into this middle age time. So there's definitely things that can impact bone health, muscle health in our bodies. That's why it's so important that we're looking at, what we're eating in terms of nutrition, our meal frequency. We want to be maintaining strength training, etc. All are super important. Okay. I do want to touch on this topic. I think many people are aware that menopause is a phenomenon that happens. That's 12 months of a woman not having a menstrual cycle. But men actually will go through andropause. And so this is when men may find they may have decreased strength, they may have some weight gain, they may deal with sore muscles beyond which they were accustomed to. They may have low libido. The number one cause of low libido in the United States, more often than not for men, is related to insulin resistance. They may also suffer from insomnia. In a 2016 study, nearly 40% of US males had low testosterone. That impacts over 13 million men. This is important. Low testosterone is almost always correlated with either exposure to estrogen-mimicking chemicals in our environment, our personal care products, or our food, or it's directly related to insulin resistance, or it could be a combination of both. And as I mentioned, I always think about Bill Gates as a great example. Obviously, probably many people in this room know that he is pushing very much a plant-based agenda. And I don't in any way want to make this a political conversation. But if you look at how unhealthy Bill Gates looks, I always say as an example, like he would really benefit from eating a bit more meat and eating a bit more healthy fats. I'm being completely serious, but that's who I think of when I think of someone who looks like they're in significant andropause. On the other hand, with women, menopause, the average age in the United States is 51 years old. And so many women breeze through perimenopause, they have no issues, but more often than not, women will experience things like hot flashes and weight gain and low libido and muscle loss and insomnia. How many women in this room have dealt with or are dealing with insomnia? Yeah, it's a real problem. It's a catastrophic problem. And all of these symptoms can be exacerbated by insulin resistance, loss of insulin sensitivity. Remember I talked about women until we start heading into menopause are largely protected from this. And this is also exacerbated by the loss of estradiol, which is that predominant form of estrogen as we are heading into that time frame. So really important to understand that interrelationship. It also is impaired by the loss of testosterone and progesterone. And I always like women to understand that, and it happens to, as it also happens for men as well, that not having good quality sleep is an issue with it not being foundational to our health. That we need to sleep well to be able to maintain good insulin sensitivity. We need to sleep well to be able to replenish hormones. There's something called the glymphatic system in the brain that only gets triggered when we're asleep because it requires so much energy. But it's our body, it's like a toilet. It's like our brain literally has a toilet, and it's only really clicked into when we are asleep. So important for people to understand that middle age, both men and women can have changes in their sex hormones, which can impact all of these areas. And if you're not sleeping well, you definitely want to figure out why and get some help. Okay. We were talking about this body composition with women. I'm not going to spend a lot of time on here, but this is just looking at what happens to women in menopause, that they have this increase in body fat, this reduction in insulin sensitivity related to the loss of muscle mass, and this can really get exacerbated. Okay, so what I want to spend the next 20 minutes on is the differences for fasting between men and women. And so with men, there's just one fasting bucket, and with women, there are three. There are women that are at peak fertility, under the age of 35. We've got women in perimenopause and women in menopause. And so the other piece that's always very, very important, not unique to one gender, is that our sleep quality is important, our stress management, our exercise, anti-inflammatory nutrition, and including low-carb ketogenic lifestyle if that's appropriate for you. Are you seeing the trends? Brian talked about this earlier. Really important. Lifestyle medicine is the first distinction. So if you're a woman that still gets a menstrual cycle, there is a rhythm called the infradian rhythm. It's a 28-day cycle, ideally. And you have multiple stages during your menstrual cycle. There's the follicular phase, which is the day that you start bleeding until roughly day 14. There's ovulation, which should happen around day 15 or 16. And then day 17 through day 28 is the luteal phase. And throughout your menstrual cycle, a woman is getting fluctuations in energy and temperature and metabolism and both her glucose and insulin sensitivity. It impacts cortisol. It also impacts sleep quality. More often than not, I have women tell me, I sleep terribly the week before my menstrual cycle, and that is a byproduct for the fluctuations in progesterone. I have women that wear CGMs and use glucometers that tell me the first part of my menstrual cycle, I'm a rock star. I can lift heavy. I can eat what I want within, a healthy range. But then as I get closer to getting my menstrual cycle, I crave certain foods. My glucometer and my CGM data is a total hot mess. And that is a byproduct of those sex hormones, progesterone and estradiol, that are fluctuating. Now, I mentioned that we have these distinctions. So under the age of 35 is one bucket. Perimenopause is 5 to 10 years preceding menopause. And I just said the average age in the United States of menopause is 51. Late 30s, early 40s is when perimenopause starts. And this is important for women to understand. I say this because I did a whole TED Talk on it as an aside, that I was not prepared as a clinician for the changes that were going to happen. So I have teenagers at home. Their puberty has been ramping up, and mine has been ramping down. It's reverse puberty. But no one prepares you for this. And so as you transition, as you're getting closer and closer to menopause, you will start generally having more and more symptoms. And so this is when I tell women, you have to sleep. If you are not sleeping through the night, please do not add in intermittent fasting, because we want to make sure that you can maintain healthy blood sugar, that you're getting restful sleep, because intermittent fasting, although a very beneficial strategy and something that has been with us since the millennium, it is absolutely a type of stress. We use this term hormesis. It is a type of beneficial stress in the right amount at the right time that can be hugely impactful. So if you're not sleeping, your stress is out of control, you're going through a divorce, you're going through a major move, you lost your job, you have a child that's ill, etc., do not add in intermittent fasting. Maybe take a break. The nutrition piece. I think that this is the lost art. One of the reasons why I left clinical medicine 6 years ago to start my business was because I felt like we were failing our patients. I did not have enough time to talk to my patients about food. My cardiology fellows were always very supportive of my desire to talk about food, but it got to a point where I said it all starts with food. That's what we're not talking enough about, that it all starts with food. You can make the best choices or the worst choices every day of your life. And then exercise. We have to move our bodies. I'm not saying everyone in this room needs to do CrossFit. I don't do CrossFit. It's not the right type of exercise at this point in my body and at this point in my life. However, walking. Everyone can walk. Just about everyone can walk. Making sure that you are doing some type of body weight training. Really making sure you're doing the right type of exercise based on where you are in your lifetime. I have a lot of women that are in their early 50s and they want to continue to do Orange Theory Fitness or CrossFit, and they're wondering why they can't recover, and they're exhausted and their sleep is terrible and they're really inflamed. And I remind them what a 22-year-old woman can get away with is not what a 52-year-old woman can get away with. And in many ways, it's a relief, right? You're at a much more secure, comfortable stage in your life, but it's the understanding it's the right types of exercise at the right time of your life. Okay, so men and menopausal women. Why do menopausal women have it a little bit easier than their counterparts who are still getting menstrual cycles? There's less hormonal flux. There is not this fluctuating amounts of progesterone and testosterone and estradiol every month. When you are in menopause, you've gone 12 months without a menstrual cycle. A lot of women are like, thank God, one less thing to worry about. So less hormonal flux with fasting. That's why menopausal women and men oftentimes have the easiest time doing it. Men statistically tend to lose body fat more easily. This is a source of endless frustration. But remember what I already said earlier. It is. I say, like, women will say, my husband's doing the same thing I'm doing, and he's lost 10 pounds and I've lost 2, or I've lost none. And what did we talk about earlier? Men tend to have more muscle mass and we tend to have more body fat. It is going to take a little longer. Menopausal women have to focus in on sleep quality and stress and nutrition and exercise and doing the right types in the right amount. I always mention that menopausal women and even perimenopausal women have to be careful about their carbohydrate intake. I'm not anti-carb, let me be very clear. But some women really struggle to understand that it might be that they aren't doing gluten anymore, they're not doing grains anymore. It's really being, very strategic about, do you tolerate, fruit? Can you have low glycemic berries? That's why I think glucometers and CGMs are so beneficial, but it's getting honest with yourself. I have some patients that cannot have fruit at all. They don't have enough insulin sensitivity. I have others that can. So really identifying for you what that right food is. Most men and women eat not enough protein, too much of the wrong types of fats, and too many carbs. That is standard American diet, rhetoric. Now, when I encourage men and women to have more animal-based protein, the right types of fats, and eating the appropriate amount of carbohydrates for who they are, they do a whole lot better. Okay, I think it's important to talk about who should not fast. Now, I see a lot of people, I have to believe they're well-meaning fit pros. I'm going to pick on the fit pros for a second. Well-meaning fit pros on Instagram who like to proudly show off that they fasted through all of their pregnancies and while breastfeeding. And let me be real. If you are growing a human or breastfeeding a human, this is not the time to restrict the food that you're consuming. This is the one time I always say that for me, I had a cousin who was an OBGYN and she said, when you are breastfeeding a child, it is like you can eat like a linebacker. I now understand that concept, having had 2 children who are now teenagers and eat like linebackers. But that is not the time to be restricting the macros that you're consuming. So wait until you're done being pregnant or done breastfeeding. A lot of women, I get this question a lot on social media as well, history of a disordered relationship with food, particularly binge eating, bulimia, and anorexia. Now, when I did my training many years ago in Baltimore, I did have a lot of clinical time at a hospital called Shepherd Pratt, which is an eating disorder facility. And so I got to train with a lot of fellows that were working in this area. Anorexia has one of the lowest cure rates of all the eating disorders. And so I find a lot of women that have a history of anorexia, it's a very tough thing for them to be able to tolerate, and I generally don't recommend it. Have I had women that have worked with me that have a history of binge eating and bulimia and a few with anorexia that in conjunction with working with an eating disorder specialist have been able to dip their toe in that pond? Yes, but it's not the most common individual. So just to kind of tuck that in the back of your mind, if you're too thin, if your BMI is less than 18, you have no business fasting, male or female. Children and teens. I have a teenager. My husband's in the audience, so he'll be humored to hear me say this. I have a teenager who's a competitive swimmer, and he does not like to eat breakfast. So we have to talk about how he can get enough food in during his day to be able to fuel his workouts and his brain to be able to excel at school. But I don't recommend kids fast. Now, does he eat within a compressed window because he doesn't eat? But he eats so much food. Remember I said he's like the linebacker. It's unbelievable. If someone's frail or elderly, I made a mistake in 2019 when I did my second TED Talk talking about people over the age of 75 or 70, and I got a lot of flack. And it was because I was required by the event where I was speaking at to give a number. And I have since been graciously humbled by the amount of individuals who have done very well fasting into their 70s and beyond. So it's always in the context, are you frail? You could be frail and be 40 years old. So are you frail, or are you someone that's, in a position where you have brittle diabetes, you don't know what your blood sugar is doing? If you lack that awareness, then you have to actually be very careful. If you're recently hospitalized, I think this goes without saying. And best practice, if you are considering fasting and you're on a lot of medications, maybe you see a cardiologist, maybe you see a nephrologist, a kidney doctor, or pulmonologist, have a conversation. I'm finding more and more healthcare professionals are really open to the concept of allowing their patients to fast safely. You do want to, if you take blood pressure medication, if you're on diabetes medication, you want to make sure they are aware, because you more than likely will need less medication. And that's a beautiful thing. That's what we want. We want to see our patients coming off of these lifestyle medications as much as possible. Okay, so if maybe you're not doing fasting, if we're doing like a down and dirty, these are the easy ways to be able to fast effectively. The first thing you do, and some people in this room may not need to hear this, but the first thing I would say, rip the Band-Aid off and stop snacking. Like, no one should be snacking. The concept of snacking is so detrimental to our health. And then once you stop snacking, you want to start with a 12-hour feeding window. Really, you don't eat between dinner and breakfast. And you might have already go 13 or 14 hours successfully. I always remind people that what will happen when you are no longer snacking is it will force you to structure your meals differently. We know protein is the most satiating macronutrient. And what that means is that if you are properly putting your macros together at your meals, protein, fats if appropriate, non-starchy carbs, then you will not be hungry in between meals. I always say when someone says to me, I feel like I need a snack in between my meals, I said, then you need to push the protein lever, or you need to add more healthy fats. If you're having a ribeye, you don't need to add more fats to your plate. If you're having a filet, you can add some fats to your plate. It's really that simple. Push the protein lever. You want to also reduce your carbohydrate intake. Now, again, in this audience, they might not need to hear it as much as a lot of audiences that I speak to. People freak out. The average American is consuming 200 to 300 grams of carbs a day, and not from vegetable sources or a piece of fruit. They're having the processed carbs. So getting your total carbs under 75 or 50 grams is a good starting point, especially if you're trying to lose weight. Absolutely important. And one of the things that I get asked about a lot is total versus net carbs. I always say net carbs is a cheat. As long as you recognize that's what it is. If they put a lot of fiber into something in an effort to get you to believe that it isn't as many carbohydrates as you're consuming, be honest with yourself. Lily's dark chocolate is a good example, right? Lily's dark chocolate, stevia sweetened chocolate, might be a little bit easier, less, insulin response or blood sugar response. And I always tell people, actually record the whole total carbohydrates. Don't say it's 20. Instead of saying it's 14, it's really 28. Call it what it is. Understanding what a clean fast is. A lot of people don't understand what a clean fast is. They think they can eat and drink anything they want. They're, again, the fit pros. I'll pick on them. A lot of people on social media, they'll say if it's under 50 calories, it doesn't count. That's actually not true. If you're eating food, that's actually breaking your fast, like grapes or banana. There was someone the other day that was saying that, and I took everything I could not to say anything about what they were talking about. So really, that's as easy as you can go. Now, the other thing about protein that I want to mention that is going to help you succeed with intermittent fasting is pushing that envelope. And I talk about 30 to 40 grams as a starting point. I actually had someone reach out to me who's in the fasting space who told me that wasn't achievable. And I said, really? I said, because I eat 40 or 50 grams in a meal. And I eat at least 2 meals a day, if not more, depending on what's my schedule's like. So if I'm having 50 grams of protein in a steak, you're going to try to say, like, that's impossible for us to be able to achieve. I think that's ridiculous. Remember, protein will shut that satiety cues. You won't be looking for more food because you will be too darn full. Okay. I think it's important in the last 5 minutes to talk about signs that fasting's not working for you. Because I get questions about these every day. In fact, my team was laughing about this because there were so many of these that came in overnight. Okay, if your sleep is good and you start fasting and then your sleep becomes terrible, guess what? You need to back up the bus. There might be something going on. Maybe you're not getting enough food into your feeding window. Maybe there's something else going on for you. Maybe it's the time in your menstrual cycle where you should not be fasting. And I talk about this a lot in my book that just came out, but as a caveat to this, when women are still getting their menstrual cycle every month, you should not be fasting the 5 to 7 days preceding your cycle. That doesn't mean you don't do 12 hours of digestive rest. That just means you're not doing a 20-hour fast. You're not doing a 24-hour fast. More often than not, the poor quality sleep is a direct reflection of the changes in progesterone. If you start fasting and your energy goes south, it's a sign that it's not working for you. It doesn't mean forever. It could be that your adrenals are taking a hit. Maybe your thyroid isn't doing well. Something you definitely have to be focused and conscientious about. Same thing with fatigue. You should have more energy with fasting, not less. That's definitely a sign that something is not working effectively. Poor cognition or brain fog, this can be from a lot of different things, but if you're not feeling that boost in cognition, that mental clarity, the feeling like you can get so many things done, you may need to take a break or reevaluate what you're doing. If you start getting weight gain, a lot of women will talk about the cortisol belly. They'll all of a sudden say, I don't understand why I've gained all this weight. And I remind them we have 40 times more cortisol receptors around our abdomen. So if you're stressed out, guess what? That's where you're going to gain the weight. So that's a cortisol belly. Last but not least, something that I take very seriously, especially in my under 35 women, loss of your menstrual cycle. I think the menstrual cycle for a woman is a barometer of your health. Whether you're in perimenopause or menopause, perimenopause or your peak fertility years, if you lose your menstrual cycle, it is definitely a sign that something is off. And it could be that maybe you're fasting too long, maybe you're fasting too frequently. It's really important, and I take that very, very seriously as a sign that something is not working effectively for you. Thank you.